Okay, we are continuing with proper skill clinician documentation for page 3 on NETSMART and DevRel from page 1 to page 7. We are now on page 3. On page 3, the focus is on pain, provider notification. If there's any medical changes, then you had to notify the physician. Patient education, which is required for every visit. Patient client education, which is required for every shift and every visit. Travel time is like, if the patient travel, you had to travel for any reason, let's say a doctor's appointment. INOs, you have to do your INOs, your intake and outputs, documenting to show that there's proper hydration and nutrition, that we are meeting the nutritional requirement for the client. As we are meeting the nutritional requirement and hydration requirement as well, we want to make sure our client is hydrated and not dehydrated. That's the purpose for the INO, and we got to document that there's no issue. The client is able to void pass urine, and the client is able to have that bowel movement. So that what shows on the INO. Proper nutrition, hydration, and that we have a client that is able to void pass urine without difficulty and also have bowel movements. And there's no constipation, fecal impaction, or any bowel obstruction. So we will talk about this. So we're gonna focus on pain. If you have a client that is verbal, you can use the pain scale here. This is the pain scale if the client is verbal, and it's either yes or no. If the and on the pain scale you have from 0 to 10. If the client is verbal, they can kind of tell you what the pain scale is, and then you would do your proper documentation here. Everything that needs to be documented. If there's no pain, we click no. We use this one for a client that is verbal, that is able to speak. And the pain scale is from 0 to 10. 0 is no pain, and 10 is the worst pain that you can possibly have. And 0 is no pain. This is for someone who is verbal. If the client is nonverbal, the client is not able to speak, there's cognitive impairment, any kind of impairment in terms of cognition, and they're not able to speak and tell you, you have to use the FLAX scale. You have to use the FLAX scale and the Wong-Baker scale. Okay, that's for clients who cannot speak, that are nonverbal with cognitive impairments. You use this one, and then you select on each here. If it's no pain, it's gonna be zeros. Okay, if it's no pain, it's gonna be 0. And you gotta document accurately. Okay. So for no pain is 0. So this is for patient with cognitive impairment and who are also nonverbal, or who has some kind of developmental delay. Okay. So you use the FLAX scale and the Wong-Baker scale. And then if there's no pain, you can document 0 here. Okay, and you do your proper documentation for that. If a client is nonverbal and there's cognition impairment, or the client is not able to speak and vocalize and tell you what is their pain scale from 0 to 10, if they're not able to do that, even though you can put no here, So as soon as we look at this page here, we can say there's either no pain or yes. The proper documentation for that client who has cognitive impairment, developmental delay, and who is nonverbal, it would be the Flack scale and the wrong Baker scale for proper documentation, okay? Because they are not able to verbalize. That's proper documentation over here. If you notify if you call the physician for any reason, you document here. If you didn't call the physician, you put no. And if you put no, and you put no new orders, no new calls, you didn't call the physician, no new orders, then you don't have to do anything here. If, however, you provider notified us, supervisor notified, and you have no orders, then you have to document. Like it says here, you got to do a detailed report here. And you got to put additional comments here. Okay. And then you got to do your physician order sheet, which I will show you in a different training, how to populate your physician order sheet if you have physician orders. And if it's a no, you just put no. You just put no, and you don't have to do anything else. You put no new calls, no new calls, no new orders, and that's it. Okay. If you have orders and you have to notify a supervisor, then you use your clinical skills here to do your documentation, and you got to give the details of new orders, and also write something additional here at the comment section, and then write your physician order, and also document that on your SN notes on page 7 when you do your summary note, because you have to have at least one summary note, a great and detailed summary note. At least you got to do a note like that on page 7. And I'll talk about it in more details once we get to page 7. Patient education is for every visit, because you have to teach your patient, whether it's on disease process teaching management, medication management, safety, nutrition, therapies. Most likely, since you're not a physical therapist or occupational therapist or speech therapist, or speech therapy, you may not use therapies a lot. You can use this one sometimes. However, since you are an RN or an LPN, your documentation is going to focus more on medications, medication, disease management, Sometimes you can talk about safety if you are doing a safety on equipment use, like Hoyer lifts, using a wheelchair safely. However, the clinicians who speaks more on equipment, or your therapist, whether it's occupational, physical therapist, or speech therapy. Sometimes RN and LPNs can teach somewhat on equipments, okay? Especially Hoyer lift safety. You can do your patient education, caregiver, family member education on nutrition, okay, on positioning, repositioning. And when you do a teaching, it can be very simple. Okay, it can be, let's say if you teach on positioning and repositioning for safety, to prevent any pressure ulcers, for mobility, to prevent contractures. You don't want your patient to be contracted. You want to try to use preventative measures. You want to use the turn, repositioning, positioning at least every 2 hours. If your patient is non-ambulatory, your patient is not able to walk, you want to do that to protect their skin integrity, to make sure they don't have any pressure ulcers, to make sure they are mobile and they are able to regain their muscle strength and to regain their mobility or to improve mobility. And you got to do that at least every 2 hours if the patient, is in compliance with that. Some patient may not be able to tolerate it. If the patient is not able to tolerate it, then you don't have to do it every 2 hours. You have to do it, as tolerated by your client, and use your clinical skills to make that determination. So it can be on that. It can be on medications. If you're teaching a medication, you teach what the medication is for, the dosage of the medication, how often the medication has to be given, whether it's BID or TID or once a day. If it's once a day, BID twice a day, TID 3 times a day, you know that. You document, especially if it's a new medication, if it's a new prescription, you want to do your teaching if you're not able to teach the client, you got to teach the family family member, caregiver, you got to teach them about the medication. You can use adverse reactions from the medication. Sometimes they don't know that every medication has side effects and potential adverse reactions. You got to teach them on that. Certain medication you are on can cause this, it can cause that. And if you notice that, you have to notify us, the clinicians. You also have to notify the physician. Sometimes they don't know that. You have to teach it to them. And let's say the patient has been on a medication and the family member or caregiver knows everything that needs to be known about that particular medication in terms of use, what the medication is used for, in terms of class, what is the medication is classified as, in terms of dosage, side effects, frequency, if it's PRN as needed, whatever scheduled. If they already know everything they need to know about that particular medication, then you don't have to teach on it. You only teach, and then you have to document here that family is aware. You put the medication name. You can put the medication name here and say that the family understand that medication. They understand it. No teaching is required on that particular medication. And once all of your notes has shown that they understand every medication this person is on, the client is on, then you will not have to teach on medication unless it's a new meds. Okay, however, you want to make that clear that they understand their medication, everything that they need to know about that particular medication. And anytime you have a new order for a new prescription, you have to do a teaching on that medication here. And what you taught over here, it say who you taught. Was it the patient that you taught this to? Was it the caregiver, which is also the family member? Okay, who you taught this to? Or if it was somebody else, you can put who it was that you taught. If the caregiver or the family member is not available, who you taught, who was it that you taught? And then the teaching method, was it a discussion? Was it a demo? Was it a handout? Did you give them a pamphlet, some resources and things like that? And usually it's not video. And then the time of the teaching and things like that. And if they verbalize understanding, things like that. Okay. And then if you teach on nutrition, if they know everything they need to know about the nutrition, then you don't have to teach anything. And usually they don't know. You have to kind of ask them, what do they know? Let's say if they're on a pureed or if they're on regular, things like that. If they know about nutritious meal, how to eat healthy and things like that. And if they already know everything they need to know about nutrition and it is properly documented in the chart that they know everything they need to know, you can document that they know everything that they need to know about nutrition. Let's say if you've done all your teaching either on medication and nutrition there, and there's nothing else to teach on medication and nutrition, you can make that clear here in your note. If you have to teach on disease management, whatever it is that you have to teach on, you can teach that here. Everything that they need to know in terms of how to manage their illness to prevent medical complications in terms of them getting sicker. Because the more they know how to manage the illness and they understand their medication and nutrition, uh, it will prevent, that will be used as a preventative measures to prevent them from being rehospitalized and for them to remain healthy. They will remain healthier, and they will remain stable in a stable condition as possible. As much as possible, their condition will remain stable because they know how to manage their medication. They understand it. They understand everything about it. They understand how to manage any illness or disease. They understand everything about it. They understand about good nutrition, healthy nutrition, repositioning, and all these good things. That is what is used in terms of preventative measures to keep them healthy, to keep them stable, to prevent rehospitalization. And also, if they are on oxygen, which is not here, you can also teach on oxygen. Okay, oxygen for safety. And all the teaching that you need to do in terms of oxygen. One of the things when a client is on oxygen that you teach the family and the client, if the client can be taught, is, no smoking because oxygen is combustible, or you cannot have fire. You cannot put an oxygen tank where there is fire because it's combustible. And there are other precautions that you have to do with oxygen in terms how you have to have the tank. The tank has to be at least half full or 3/4 full. If the tank gets to be like is not at least 3/4 full, if it's like half full, you don't want the tank to be empty before you reorder a new tank to make sure the patient is on oxygen. They never run out of the oxygen. So you can teach everything you can teach that you know of in terms of a skilled clinician on oxygen for their safety. And if you have an oxygen tank, the oxygen tank have to be upright. Your oxygen tank have to be upright at all time. You cannot lay it flat on the ground. Things like that. Everything that they need to know. And if you talk to them about oxygen and you see that they know everything that they need to know about oxygen, then you can document they know everything that they need to know about oxygen. And they have to have also, if you're on oxygen, you have to have a non-smoking sign on your door that oxygen in use, no smoking. And you cannot have any fire near that tank. And if the client is an adult, they should not be smoking near the tank or have fire near the tank, things like that. So that's part of safety. So you can click on safety, equipment, you can click teach on safety. One of them is how to lift, or even the wheelchair, for them to use it. Any kind of teaching you do, you document it here. And let's say throughout that chart, it has been demonstrated that you have done teaching and the family member or the client understand everything in terms of patient-client education, taught to whom, and the method that you used to teach this, whether it was, it was a discussion, you give them some resources, like, some paper resources, handout, something that is in writing, you document that in the time. Let's say the client has a catheter. Let's say the client has to be straight cat, and you want to document on how to straight cat a patient, and they have to do return demonstration. So then that's when you can click on the response here. Correct demo return. If they have to do return demonstration, like the family or caregiver, if it's correct, if they are doing it correctly and they are independent with the procedure, Okay, and they verbalize understanding, you put it here. If they are not doing it correctly, let's say a client has a new order to be straight cut every 4 to 6 hours. If they are not independent and they're not able to do it on their own and they need further teaching, you click on this and you click on the reason. Okay, that's part of the response. And once if your client has an indwelling catheter, you have to do catheter care daily. The catheter care that you have to do daily, you have to do peri care, the perineal care, and then you have to empty the urine. You have to empty the urine, make sure, you have a clean catheter thing. You have to empty the urine from the catheter thing itself, whether it's a suprapubic catheter or whether it's an indwelling catheter. You have to do catheter care daily if it's an indwelling. And then you have to teach the caregiver or the client, they have to make sure they do good pericare to prevent infection or a UTI. So you can do teaching on that if they have a catheter, how to prevent UTI and the signs and symptoms of a UTI. And then you do pericare daily, and then you empty the catheter bag daily, you empty the urine out daily, and you do your measurement with your intake and output. And you document everything that needs to be documented. However, you have to teach something. And let's say this person, the client or the family or caregiver knows everything. They really, really know everything. They are able to verbalize it to you, and they are independent. They need no further teaching. And you then provide teaching. You can put teaching not provided this shift, and you put the reason why. That the client understand how to manage nutrition, medication, their equipment, disease process teaching management. They know how to manage everything. There is nothing else for you to teach them. The only time you don't do any patient education, client education, family caregiver education, the only time you don't do it for your shift is after you have taught them everything that they need to know for preventative measures to keep them healthier, to keep them stable, and keep them out of the hospital, to prevent medical complications, even for infection control measures. So the teaching is important. A lot of clinicians are marking not applicable for everything. That's not good. That's not good for you to mark not applicable and no teaching whatsoever was done. Okay. So you have to teach on something, and it can be very simple. It doesn't have to be complicated. And then the time of the teaching, when you started the teaching, and the time the teaching was done with. And then over here, where it says discharge planning, you want to click on this, continue care needed, discipline review. That's mean the client needs continuation of care. Okay. If the client is stabilized, there's nothing that needs to be done. Whatever applies, then you can click on whatever applies here. However, you have to click on something here under discharge planning for every visit. Continued care needed. Okay. If you want to initiate the discharge process, the client is stabilized, there's nothing else that we can do for them. Whenever the time is, you can put that, there. You can put that there, okay? If there's nothing else that needs to be done, and you can put that here, and anything that applies here, and you can also put under comments, anything that applies. However, you have to click on something here under discharge planning, whether it's continued care or something else. You have to click on something. Travel, it's either yes or no. It's either yes or no. Let's say if a client has a doctor's appointment, and then you have to put your departure time and things like that. You have to put whatever applies to the client. Okay. Whatever applies to the client. If there's no, you click no. You don't have to do anything else. Accompanied by, okay, you gotta who are you accompanied by to the doctor's appointment? Destination, you got to put where is the destination. Arrival time, when you arrive. Mode of transportation, you have to put it here. Return destination, you got to put it here, and your return time, you got to put it here. And that's if it's a yes. If it's a no, then it's a no. You don't have to do anything else. Okay. And then if you do that, there's a care coordination note that you can also write so everybody understand. Okay. And then you can put that there. Let's see, 3:30 p.m. and your return. Okay, whatever time it might be. Whatever time you want to put. You know, whatever time you want to put, whatever. So to kind of, so everybody will read your note, and let's say if a client decannulated, whatever, for whatever reason you have a doctor's appointment, you have to write that here and all the details. If it's a no, it's a no. For INOs intake and output, you got to put your time, okay, and the type of what it is, the type, if it's a regular meal, okay, if it's a regular meal, you can put your regular meal, and then if it's regular meal, you know, regular food or regular food or meals. And then the amount, you can write a bowl of cereal, okay? Or you can write bowl of soup, okay? If it's breakfast or lunch, okay? If it's ml per hour, if it's a formula, whatever, you can put 65 ml per hour. Okay, you can put 65 ml per hour. If it's regular food, you can even write what kind of food it is. You can put a bowl of cereal, a bowl of soup, whatever it is. You can write it here, what it is. If it's a formula in terms of your mLs, you can put 60, okay? Whatever the doctor's order is, 65 mLs per hour, okay? And then the route, you can put the route, okay? If it's regular food, okay, it's gonna be PO because it's regular food, okay? You can put PO if it's not PO. If it's a GT, you can put if it's a GT, NGT, whichever one you wanna put, okay? And if it's solid, you can put if it's solid food. If it's regular food, you can put, you know, it's regular, solid food. Okay, client had a bowl of cereal. A bowl of cereal. Okay, and then sometimes you can write client had a bowl of cereal. And sometimes even to make it even clearer, you can write if they ate, what is the percentage of that food did they eat? You can write it here in percentage. Okay, that's solid food. You can write it here in percentage. If they ate all their food, you can write 100%. So that, and then you're gonna put the time. Okay, this is gonna be morning time. You can put your time. If it's breakfast, okay, you can put your time. Okay, if this is breakfast, if it's lunch, you're gonna put your lunch time. Okay, you're gonna put your lunch time. Okay, let's say we are doing breakfast here. You can put your breakfast. Okay, we'll choose 8:30 a.m. Whichever time applies for your client. Okay, regular food or meal. So they know the client is on regular foods. They ate 100%, whatever percentage of it. If they didn't eat, if they eat less than 100%, you can, so that way they know. And then PO, meaning they are able to eat by mouth. And if it's regular size, full client had a bowl of cereal, a bowl of soup, whatever the client had, rice and beans, whatever the client had. If it's lunch or dinner or supper, whatever the client has. If it's solid, whatever the client has, you can write it here in details. And then over here in amount, you can put the percentage. Okay, if it's pureed, you can do the same thing for pureed. You can do the same thing. You just put whatever type it is. If it's pureed, you just put pureed over here. Pureed mechanical soft, you can put it over here. But so that's the type of food, regular, pureed, whatever, you put the type. If it's a formula, whatever it is, you put it here and you put your time. Amount of ml, if it's bolus, you can put whatever bolus here. You can put whatever. You can put whatever number you want. After you put the number and you indicate it's bolus, and how many mLs bolus. If it's not bolus, if it's ml per hour, bolus, and then you put your mLs. Okay, whatever number it is, it could be 185, whatever it is, it can be 165, bolus. And then you write the name. Let's say if it's pediatric peptide. Okay, if it's pediatric peptide, you put it here, and then you put 165 mLs bolus. You can put 165 ml bolus, whatever you want to put. Whatever the order is, bolus. If it's not ml bolus, if it's per hour, then you can put 65 mLs per hour. Okay. And then the route you can put whether it's your jejunostomy tube, okay, or whether it's a G tube, whatever, whichever one, whatever the physician order says, because you are following physician orders on this. Okay, this is how you document your intake and your output. And then if they tolerated it, you put yes. If they didn't tolerate it, you put no. And then you do this. Let's say if it's 65 ml for your shift, and then you keep documenting until your shift ends. You keep documenting until your shift ends. If you have to kind of pause it, and then you have to kind of do other things like other treatments, water flush, whatever you're doing, you know how to document your intake and output. And you also have to put your water flush. If you have to do ferro bags for residuals, if there's a doctor's order for it, that is part of your intake and output. You document everything here. And then you should have a number over here. Okay, by the time you are done with it. All right, let's put 65 here. And then we can put the time, whatever it is. And then you should be able, okay, you see how you have 65 here? Whatever, it's gonna give you a number. And make sure your numbers are accurate. Okay, make sure your numbers are accurate. Even for your flushes, you put your flushes here, you put your ferro bags here, your residuals. If you have ferro bags and you have to do a give back, the residual, the amount of give back, you put it here, okay, as part of your intake and output. And then if the client should be able to urinate during your shift, you have to document that here, the time. If the client is able to urinate, the time the client urinated, you write it here. If the client had a bowel movement, a stool, you write it here. Let's say if the client is continent. You can just write the time for urine. You can put either a small amount of urine, you can put moderate amount of urine, or you can put a large amount of urine. Okay? And then if the client had a stool, you do the same thing if they are consonant. If they are not consonant and you're not able to measure, you're not able to do a measurement from the diaper, then you can put diaper here. Okay, or if it's a toddler, you know, that is still being potty trained, things like that, for whatever reason, at least when you do this, it shows that your client had a bowel movement and what time that they are not constipated and there's no urinary symptoms. Because if you're not able to urinate on your own, then you have to be you have to be catheterized. They have to use a catheter. We have to get doctor's orders for that. If the client is able to urinate on their own, void and pass urine, that's a good thing. So we have to show that here. And if your shift is a few hours, don't only document this once. You got to document it. You got to document this at least every 3 to 4 hours of your shift, because a client has to be able to void and pass urine at least every 3 to 4 hours. Stool, if they didn't have any stool on your shift for that particular day, you don't have to write anything. However, you have to make sure your client is not constipated. Routine bowel pattern for some client is twice a week. That's their routine bowel pattern. They're not gonna have a stool every day. And some client have stool every day, and we already talked about that on another training. As you know, as long your client is not, constipated, they don't have no fecal impaction or bowel obstruction that's gonna lead them into peritonitis, we are good. And clinically, if you don't have a bowel movement in 4 days, clinically, in the medical world, it is considered constipation. The medical terminology of no bowel movement in 4 days is considered constipation. And that's when you already call the doctor if you don't have orders. If you have doctor's orders to give certain medications, you make sure you give your medication, whether it's a stool softener or if it's a laxative. You give those medications so that way your client is not constipated. And then you don't have to call the doctor and we don't have any medical complications that could have been prevented. Those are preventative measures. Preventative measures. And then for your output here, you don't really have to document a lot. You just got to document they are able to void, have you pass urine, and have bowel movements. And once you make that clear, that is good for this page here. However, you have to have your amount here. If for some reason, NETSMART and Devrel, it should populate because it populated it for me. If it doesn't do this, where you have your numbers here at the bottom of NETSMART, Endeavor, you have to put it on page 7 in your nurse's notes in terms of your intake and how many mLs. Okay? At least you should have it here at the bottom of NETSMART Endeavor. And then once you're done with this very good documentation, with this clear documentation, then you can click save to save your documentation. And that's the documentation for the training for NETSMART Endeavor on page 3. If you have any questions, you can always either send me a text and then we can discuss it. And that's it for this presentation. Thank you for your time.